Dear audience, I'm happy to present you my current PhD progress. My name is Anita Gréta Perényi. The title of my thesis is Assessment of Nutritional Habits of Pregnant Women. I'm an internal medicine resident from the Institute for Pancreatic Diseases, and my supervisors are Nando Raj and Zsolt Melzer from the Department of Obstetrics and Gynecology. My SMS is Lurin Sprivalski. Our vision is to normalize gestational diabetes with lifestyle medicine and nutritional counseling. And our mission is identifying the dietary factors modulating the therapeutic response in this population. We have two ongoing projects. The first one is investigating the efficacy and safety of polyunsaturated fatty acid and vitamin D supplementation on carbohydrate and lipid metabolism parameters among gestational diabetic patients. Gestational diabetes affects approximately 10% of pregnancies, and it's been associated with a wide range of severe adverse outcomes. It poses a tenfold higher maternal risk for developing type 2 diabetes in the next 10 years, but short-term adverse events affect the offspring, like macrosomia, premature delivery, or problems with neonatal adaptation. There are suggestions in scientific literature that a low-grade inflammation may play a role in the pathogenesis of the disease. Omega-3 fatty acids have promising anti-inflammatory effects, and they can improve insulin sensitivity and glucose tolerance. Vitamin D is a fat-soluble nutrient. It regulates many cellular functions, and it can have direct impact on insulin action via gene expression. The standard care of gestational diabetes is based on lifestyle modification, but when diet and physical activity are not enough for maintaining an optimal metabolic balance, insulin administration is needed. Our intention is to find safe and effective substances in the prevention of adverse events related to gestational diabetes. Our clinical question is the following: is higher polyunsaturated fatty acid and vitamin D supplementation better in gestational diabetes than standard care alone? The population will be gestational diabetic patients. The intervention 1 will be polyunsaturated fatty acid supplementation. The intervention 2 will be vitamin D supplementation. And the intervention 3 will be the co-supplementation of the two compounds together. The comparator will be standard care alone. Primary outcomes will be maternal glycemic and lipid parameters. The secondary outcomes will be fetal anthropometric parameters, mode of delivery, and maternal inflammatory parameters. Our hypothesis is that polyunsaturated fatty acid and vitamin D supplementation has better effect on glucose metabolism than standard care alone. The clinical research implication is improvement in maternal metabolic parameters and decrease in neonatal complications. Here you can see the final search key of us. The first domain refers to the population, and the second one refers to the interventions. Below, in the bottom, you can see the number of hits highlighted with red. Prospero registration just have done, so now today we are planning the duplication removal. The second project will be a longitudinal prospective open-label observational study. The title of it is Investigating the Effects of Diet Composition and Micronutrient Intake on Carbohydrate Metabolism Parameters and the Development of Gestational Diabetes. In the context of this topic, first we need to talk about nutrients. Macronutrients like carbohydrate, protein, and fat provide us energy, while micronutrients like vitamins, minerals, or trace elements are involved in biochemical processes and metabolic pathways. The exact recommended diet composition, even in guidelines for managing gestational diabetes, remain uncertain. Our objective is to evaluate and compare the energy and nutrient intakes and the dietary patterns of healthy pregnant individuals with those patients who are developing gestational diabetes. We would like to use the following methods: a food frequency questionnaire for identifying the most common consumed ingredients, a 3-day food record, or we can call it food diary, performed in each trimester of pregnancy with the involvement of 2 weekdays and 1 weekend day. This method is appropriate for the estimation of energy and nutrient intakes of the individuals. We would like to use calibrated and validated measurement tools for the assessment of anthropometric parameters of the participants. And because physical activity also has a huge impact on metabolic health and weight gain, we would like to incorporate a standardized physical activity questionnaire for our measurement. For verifying our measured data, we would like to use serum and urine biomarkers. Now you can see the planned follow-up. The inclusion will be in the first trimester of pregnancy, and we would like to follow the participants 6 weeks after the delivery, and the measurements will be performed in each trimester of pregnancy. The inclusion criteria is adult pregnant individuals with singleton pregnancies, and the exclusion criteria will be pediatric population, multiple pregnancies, patient diagnosed with eating disorders, or poorly controlled internal medicine disease. Our clinical questions are the following. What are the most beneficial dietary patterns for metabolic balance? What proportion of nutrient intake is provided by dietary intake compared to dietary supplements? And can higher micronutrient intake have a preventive effect on gestational diabetes? The population is pregnant individuals. The exposure will be various diet with multiple micronutrient supplementation. The comparator will be no micronutrient supplementation. And the primary clinical endpoint will be developing gestational diabetes based on the oral glucose tolerance test performed in the second trimester of pregnancy. Our hypothesis is that higher doses of micronutrient intake have a preventive effect on gestational diabetes. The clinical research implication is positive effect on maternal metabolic parameters. As a summary, I can see the 2 projects with the planned submission dates. And now I would like to thank your attention with a quote from Anita. The right nutrition is not only a fundamental tool for preventing diseases, but also for their treatment. Thank you so much.
Thank you.
Thank you for your great presentation. Are you planning to do a subgroup analysis at your first project?
Thank you for the question. If we are going to have enough data, we are planning to do subgroup analysis based on different kind of fatty acids, because when we use the term polyunsaturated fatty acid, it refers to a number of different kind of compounds with different kind of chemical structures and physical properties and different kind of physiologic effects. So, yes.
Congratulations on your presentation and your very relevant topic. In your first project, what is the dosage of vitamin D given to the patients, and will every patient receive the same amount, or what do the article write?
Thank you for the question. There's a high heterogeneity between studies. Some of the studies supplemented vitamin D in higher doses than the recommended tolerable upper level, because there are different kind of approaches in the supplementation of vitamin D. For example, an everyday use or a higher saturating doses. This second approach is not routinely recommended now because of the lack of safety data. So our intention is to evaluate that is it safe or not supplementing in higher doses than the recommended one.
Can you say the number of what this dosage was, like the high one that is might not be safe?
The recommended higher doses is 4,000 international units in each day, but I'm not sure that I remember well the doses, but there was an article with 5,000 in each day, and there were even higher, but not everyday usage.
Okay, thank you very much.
Thank you for your presentation. I have a question about the second project. You mentioned poorly treated internal medicine diseases. Can you give some examples for them?
Thank you so much for the question. For example, a poorly controlled thyroid disease can lead to excessive weight gain or lower weight gain than the recommended. For example, this is a potential confounder.
Thank you.